5 things you need to know about eyelid surgery. 1. Is it part of a facelift? No, it is not. A facelift is about the neck and the lower face. Eyelids are a separate procedure. However, you can do eyelid surgery at the same time as a facelift, or you can do them separately. 2. Value for money. Are the eyelids worth doing? Are they worth the money you expend? Yes, in my opinion, eyelids are probably the best value for money. If you look in the mirror as you age, you will see that your upper eyelid is hanging and your eyes look smaller. And we can correct that and make you look happier, more contented, more youthful, and better for business. As people see you, they first look at your eyelids. 3. Deformities. What are the deformities that cause the eyelids to change? The upper eyelid is usually a problem with extra skin because over a lifetime one blinks and moves that part of the body more than any other, stretching the skin of the upper eyelid, which hangs down and makes the eye look smaller. The lower eyelid is a different problem. It is more a fat problem. You have 3 little fat pads under the lower eyelid. These can be congenital or they can be exacerbated by aging because as you age, the tissues in front of the fat pads stretch or become lax and they protrude more. 4. Recovery. How long does it take to recover from eyelid surgery? I can speak from personal experience. When I had my eyelids done, I had them performed on a Tuesday and I went back to work on a Monday the following week with just one dime-sized little bruise that I cover with a Band-Aid. The trick for quick recovery is 3 things. 1 is elevation, 1 is cold, and 1 is pressure. And if you do these properly, as I can instruct you, you will be back quickly. 5. Choosing a surgeon. How do you choose a surgeon to do this most delicate procedure? There's a trick. You ask the surgeon if he can perform the surgery in the hospital. Legally, all doctors that are MDs or DOs can do eyelid surgery in their office, but they may not be trained to do this. The hospital will credential the surgeon before they will allow privileges for that surgeon to perform the procedure in the office. So if the surgeon says that he can do the procedure in the hospital, then he's probably well qualified and trained. But it doesn't mean that you have to do the procedure then in the hospital. You can do it in the office if you so elect. It just means that he's well trained. So these are 5 things you need to know about eyelid surgery.